Amiea Clinical Microneedling, the future of dermal aesthetics is now. The Amiea Revive MN is the most clinically advanced microneedling device on the market today. All of our devices and single-use cartridges are manufactured in Germany with an emphasis on quality, precision, and power. Each Revive MN device is equipped with an AC power plug that fits into any standard electrical outlet. The handpiece cord is inserted into the back of the device. The silver button on the left-hand side of the unit will power the device. When you are ready, press the Go button. The LED display and soft touch surface pad allow you to easily adjust the speed of your Amiea Revive MN device. The number displayed on the screen is the number of hits per second that the device is delivering. The frequency can be adjusted to 50 hits per second all the way up to 150 hits per second. The device must be on in order to adjust the needle cartridge. The dial on the device controls the length. One full clockwise rotation will adjust the needles 0.8 millimeters. You can retract the needles and extend the needles to suit every patient's specific needs. The etched markings on the handpiece dial will line up as you turn, letting the operator know that they have increased the needle depth by 0.1 millimeter with each turn of the dial. This way, the operator can easily adjust the needle depths to treat every different type of skin surface, soft scar tissue, or even static scar tissue. Prior to starting the procedure, a topical anesthetic is applied to clean, dry skin. After approximately 15 to 20 minutes, you are ready to begin. Start by cleansing the skin to remove any residue left on the skin from the topical anesthetic. Once the skin is properly cleansed and sterilized with alcohol, you are ready to begin. A topical gliding gel serum can be applied at this time to ease the mobility of the device across the skin. Start with a low needle depth and velocity and increase as necessary. It can easily be adjusted as you move the handpiece across the different areas of the face. Each separate needle cartridge is designed for one single use. All needles have patented safety membranes installed into the cartridge so that there is absolutely no risk of cross-contamination that is possible with other devices. The chin is a good place to start to show what type of results you will get in accordance to the settings on the device. Move swiftly in quick circular motions. As you pass across the skin, you will see small pinpoint bleeding. This shows that you are operating at the recommended needle depth and device speed and with the proper amount of pressure. If you do not see the microdots, increase the needle depth. If the bleeding is too hard, reduce the needle depth. Keep a sterile gauze pad in the treatment area to wipe away any excess bleeding. Continue to operate at the proper needle length and pressure in accordance to your patient's skin. Because the Amiea Revive MN is German engineered and the motor in the handpiece is attached to the power plug, you never have to worry about the device overheating or warming up in your hands as with some other devices. Always try to keep the handpiece in a vertical position for maximum control. It is also important to stretch the skin to achieve an even perforation of needles to the area. Continue to move the device upwards across the facial terrain, moving swiftly across the cheeks. The needle depth and pressure will need to be adjusted because the skin on the cheeks is thicker than that in the chin area. Go over any problem areas, such as acne scars, several times for greater efficacy. The Amiea Revive MN has a tilting needle plate, allowing the operator to reach difficult areas. The needles only perforate the skin for an instant, reaching all the way down into the dermis to stimulate collagen production. Because the movement is so fast and precise, the epidermis stays relatively unharmed. Unlike alternative methods, there is very little downtime for the patient with superior results. The Amiea Revive MN can also be used safely around the eyes. The tilting plate and 6 microneedles allow the area to be effectively treated, yet precisely controlled. Adjust the needle depth according to properly treat the thinner skin. Because the forehead has a very thin layer of skin, the pressure should be adjusted and the needle length should remain at a decreased depth. Continue with swift circular movements across the area. Move the handpiece downward to treat the nose. The device allows you to reach difficult areas around the nostrils that would be impossible to reach using other devices, such as a traditional roller. Once you have completed one side, you can now start the process on the other half of the face. Continue on starting with the chin and working your way upwards. Continue to adjust the needle depth and pressure in accordance with what area of the face you are working on. As a general rule of thumb, the thinner the skin, the less pressure and needle length you will need. From start to finish, an entire face can be treated within approximately 20 to 30 minutes. The time can vary based on a patient's skincare concerns and what type of skin you are treating. The Amiea Revive MN device is safe for all skin tones, including darker tones. Because you are treating the dermis and leaving the epidermis relatively unharmed, there is a low risk of post-inflammatory hyperpigmentation and a very low risk for infections due to the rapid closure of the perforations. When you are finished with the procedure, wipe the area with a sterile gauze pad. The face will be a bit red post-procedure. Because the skin is perforated and not ablated like a laser would do, the epithelial function can be rebuilt within a very short amount of time. The perforations stimulate the body's own ability to create collagen, which results in younger, healthier-looking skin. Apply a layer of aftercare balm to soothe the skin post-procedure. It is also important to have the patient apply sunscreen if they are going to be outdoors. Because the skin is already beginning to repair itself under the surface, the patient may also apply makeup in as little as 2 hours after the procedure. The skin may be slightly sensitive for up to 48 hours after the treatment, but the patient will be able to resume their normal day-to-day activities immediately following the procedure. As the skin continues to heal and collagen is produced, more youthful skin emerges over the following weeks after the treatment. For optimal results, Amiea recommends 3 treatments at 4 to 6 week intervals. Regain yesterday's beauty with today's modern technology. Invest in the future, and with Amiea Revive MN, the future of dermal aesthetics is now.